Welcome to the Caregiver Relief Podcast, where we bring you insights, tools, and conversations to support family caregivers and aging adults. I'm your host, Diane Carbo, a registered nurse, and today we're diving into the exciting world of technology in elder care. Our guest is Aparna Pujar, founder and CEO of Zemplee, the world's first AI-powered platform that helps caregivers provide better, safer, and more compassionate care. With a remarkable background in leading product strategy at eBay and Yahoo, Aparna is now using her expertise to transform how we support seniors, whether at home or in senior living communities. So join us as we discuss how artificial intelligence can make caregiving easier, safer, and more effective for everyone. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Aparna, thank you so much for joining us today. I know you're very busy. You've had such a fascinating career in technology. Can you share a little bit about your personal journey and what inspired you to create Zemplee?
Thank you all, and thank you for having me on this show. I'm really excited to be here. Yeah, on my background, so I started my career as a programmer. So I have worked in multiple roles, starting from a programmer, led engineering teams, led product teams, led business teams. So I've grown through in the tech industry, mostly working on technology platforms, building large-scale technology platforms. Zemplee actually started as a labor of love. I started Zemplee because I became a remote caregiver for my aging parents who lived out in India. And just going through the day-to-day process of helping them with their lifestyle and their needs and their care needs was such a huge challenge for me, because part of it was they were halfway across the world. Second of all, I was a mid-career executive, full-time job with kids at home, and high school age kids at home. So realize the complexity of what a commitment to taking care of your aging parents really was. And no one is prepared for this job, right? So you get into it and you're learning on the job, trying to figure things out. And a large part of that I felt was just the piece that was missing, right? Information access and collaboration. Because at any given point of time, I was relying on multiple people who had to give me inputs on what's happening with my mom, what's happening with my dad. And that sort of set of people ranged from caregivers in the home to clinical people, physiotherapists. And to me, it was just a matter of tying all this information together so I could get a holistic view of, okay, this is what my dad needs, this is what my mom needs. And so make the right decision on their behalf. And I think in regardless of how the family and the social structures are, usually an adult child is still required to make a decision on behalf of the elderly parents. I have to make decision on this. I better have all the information I need, because I don't want to do the wrong thing. Definitely not for my parents. It became very personal at that point of time. And that sort of made me realize that there's one part, as a family member, you have a stake in this. So you have to be sure that whatever you're doing is 100% accurate, right? There's a relationship at stake. There is love. You do want to do the right thing for your parents. And of course, that sort of made me realize that if I was going through this, imagine what a caregiver who's not connected to your family the same way is going through, right? She has double the responsibility, maybe triple the responsibility of doing the right things for someone who is a paying customer to her. So I think as I realized, I could probably get away by not doing things on time, but a caregiver doesn't, right? This is a professional relationship for her. So just felt like there was a need for providing a tool that will just help with easy decision making, information access, better collaboration, and used all my knowledge that I had gathered through 30 plus years of my experience building technology products and brought it to this domain. And that's how Zemplee started. And I met my co-founder who was also like a remote caregiver for his aging dad. So it was a meeting of minds and we said, we got to solve this and we got to solve this the right way. And we had to bring the right technology to solve this and understand. Really, the journey has been about just understanding the world of what a caregiver encounters, right? And then trying to find ways to see how we can be helpful to that person. And in such a way that she feels good about what she's doing. First of all, she has peace of mind. The family that is caring for their elderly loved ones also feel good about this and feel comfortable about this. And then, of course, the most important person, the elderly person, right? How do we make sure that they also feel good about this? So it's like what I call as it's a village, right? So you have to bring all the people together and make it work for them. But two things that went into this was we consciously decided to stay away from using video cameras, right? As a image recognition as a technology has been around for the last 15, 20 years now. But we had to understand that we were going to be in homes of these people. We had access, some parts of which was very private. And we consciously made a decision to not include video cameras in our software because it's very easy to take a screenshot of something and say, "Oh, this person needs help." So, I think what we realized as we were going through this was a large part of the people that we serve are women, and as a woman, I felt I have to uphold the dignity. Like I don't want to be surveilled all the time.
Yeah.
How do I build a system? How do I build a tool that allows me to uphold my dignity and my vanity, right? And still do what it needs to do in order to make sure that the people who are caring for me get a peace of mind, right? So I'm not starting to become like this, a concern for them. And yet the family also feels really good about using the technology to do what they need to do. So that's how we came up with the product part. And we
That's fascinating.
Yeah,
Fascinating to me because I know I support family caregivers and seniors, and privacy is one of their biggest issues. And I love that you took that into consideration when you were developing your product. For those unfamiliar, what exactly is Zemplee and how does it work in a home or senior living center?
Yeah, the product itself is an array of sensors. So they are motion sensors, they are what I call as touch sensors or pressure sensors, and then they are door sensors, right? So we send a kit of sensors to a person's home, or if it's in a facility, it's either enterprise-wide to a facility or even individually for a living unit in a facility. And these sensors get placed on walls, they get inserted into your appliance, into your furniture. And then we have sensors that get placed on the refrigerator. So the design of the sensors in such a way that they're passive in nature, right? They are in the background, observing you without really observing you, right? Tracking your individual movements. And then every time you're moving from, say, point A to point B, or you decide to sit on a sofa, or you're opening a refrigerator door, it's stringing together a series of events. Then it stitches that together and forms, okay, here's a day in the life of Aparna or Diane for that matter, right? Yeah. And then it uses that as a blueprint to start detecting anomalies. If habitually you're the type of person who gets up at 7 a.m. and your next activity is walking into a kitchen and grabbing a cup of coffee, it's mapping that out, but for whatever reason that doesn't happen. Say it's Tuesday and you decide you didn't wake up by 8 a.m., the system gets into a supervisory mode and then informs someone, right? And that someone can be a family member, or in an institutional setting, it will be the staff in a facility. And then they have the ability to now go intervene. So for in the family case, it's very, especially if your family is remote, they get an alert on their phone. And so obviously the actions that they can do is call and check on them, right? So simple. Or if they're nearby, they could drive home and check. And if sometimes we've seen people just recruit their neighbors also to be this person to go and check in on them. So we've seen like a little bit of that community part also built out as part of the rollout. In a facility, it's a more formal setting. So they change their workflows to manage an exception-based intervention with the resident.
So you're actually able to monitor and detect changes in an older adult's daily behavior or health?
That's correct. Yeah.
That's fascinating. Now, caregivers often fear technology replacing human touch. How does Zemplee enhance rather than replace caregivers?
The tool is designed for a caregiver. So this is to make a caregiver's job easy. We don't foresee a world where our technology will replace a caregiver for two reasons. Because this is care and you are dealing with the vulnerable population. The human touch is an equally important part of this delivery model. And we, first of all, believe in that 100%. There are some things that our AI will not do. Like our AI will not help them with toileting and bathing. Yes. That's something that a caregiver still is required. But to the extent that we can help the caregiver better manage workflow of her work and then help her eliminate some sort of, say, tasks that a system can take over and do for her, giving her some time to improve the qualitative aspect of care, that's where we see a huge impact of the tool. At the end of the day, any technology is a piece of tool. It's a tool. It's how you use it and how you derive the benefits from it. That dictates the overall quality of the end user's experience. The focus for us was always that we went with the philosophy of we don't want to teach the elderly people to adapt to a new technology, which is why the passiveness was part of this. Because I had experimented, my dad and my mom were my guinea pigs when I was building this product. I gave them a lot of gadgetry, I gave them a lot of things, but the shelf life of those were at best 3 weeks. So I said I needed a system that didn't require me to train my mom and dad to use something.
Yes.
And so that became very easy because the only people who learn about our product are the caregivers and the staff who do it anyway. They do it because they're used to using other tools. So adding a tool to their kit doesn't prohibit them from doing. And then there's only value. So what we have seen with the tool now is in an institutional setting, they're starting to rethink how to change their care plans, right? One big advantage of that is acuity-based care plans, right? Some people have high needs, some people don't have as many high needs. So the data now gives them like a map of, okay, here is Mrs. Jones in room number 302. I need to change the way my caregivers are interacting with her. So that's what comes out of the data. So the data provides a lot of evidence, and then that drives the operational rework in the facilities. In the home setting, it's really peace of mind. The fact that if I'm not somebody's watching my mom or dad makes a huge difference.
I can see this being a really good product for people that are working caregivers and long distance caregivers, especially. And there's so many because it allows those from far away to monitor and see things going on in the house. And as you say, it picks up changes in behaviors. And that's really important because the biggest things are you worry about falls, you worry about them not eating, you worry about them having social interaction. And one of the things that I do, Aparna, is I encourage people to develop a care team partner approach. Have people that you can count on to help with practical assistance, making meals when you can't get to it, or taking the dog for a walk or picking up medications for you and stuff. So I really see this as a real plus for a lot of caregivers to be able to even leave the house to run to the doctors themselves and not have to worry about what's going on, because they can be alerted if their family member gets up and moves and they're not supposed to or something. It would be a big impact for them to be able to run home or call and say to one of their care team partners, hey, could you check on mom while I'm at the doctor's? That's really important.
Absolutely. Absolutely. Yeah. And one of the things that we did, and this was looking back, it was absolutely the right decision we made, was we brought in Alexa and integrated it with our technology platform. So Alexa has been a great component for us to be able to interact with the end user. And it's voice-based. It's very simple to use. There's a video if optionally they wanted to turn it on. And one of the things we were trying to address at that point of time is, how do I make sure that this person is engaged? So sometimes when you have technology and you're collecting all this data, you tend to forget that there is a human aspect to this. So we incorporated Alexa, and we worked with Amazon. We're one of their development partners, and took the Alexa Smart Properties component and brought it into the home care market. And one of the things that we do now is we program Alexa. It's a customized Alexa device for the senior in the home. We send a lot of prompts like from our system into Alexa, so we could activate trivia or funny jokes, and they appear on your Alexa screen. And then we can now, when people engage with that, we know that, okay, they're entertained, right? So entertainment is a proxy for us to know that, okay, they're okay, not feeling lonely, and it addresses some aspects of anxiety as well. And it's just a fun thing. We have had very interesting stories where one person actually prompted Alexa to give her like a crochet knit pattern, and she knitted a whole sweater just using the Alexa. There are these fascinating stories we hear from our users that just are simply stunning. Like, we would have never imagined that to be an application, but we know that most of our people are listening to Our Daily Bread, for example, and then we know, okay, there's the faith aspect that is being addressed through that. They're listening to iHeartRadio, so we know that they're entertaining themselves, and they can change the channel. I don't like country, I'll use rock. So Alexa itself brings this entertainment component into the home, but it's curated entertainment. So obviously we manage the programming part of it, so that first of all, we ensure that it's safe and it's HIPAA compliant. Because it's in a controlled setup. And of course, the care teams are using Alexa to communicate with the client. So they drop in, they can check in on them in a remote world. So if Zemplee shows something that is saying, okay, I'm not seeing something, this person needs attention, they will just use a nurse station version of the Alexa to drop into the client, no matter where they're in the world. So we have people going across the country now. Someone sitting in Minneapolis can drop into someone in Florida and check in on them.
I love that, because one of the biggest issues we have with our aging population is social isolation and loneliness, and it's rampant. And I love that you're addressing that, because seniors, they need that help, and we don't have enough youth to take care of our seniors. So everything's falling on the family caregiver, which is putting a lot of pressure on the family caregiver. So this actually helps support someone if they want to age in place. It's obvious you support independence and you're trying to keep seniors safe. How do you do that? How do you support the independence, but you're keeping them safe? Can you tell me a little bit about some of your programs and what they entail in the home?
Yeah, so there are two ways. So let's say, first of all, if you've decided that you want to be in your home, you basically work with one of our partners and say, hey, usually it's a family conversation, right? So the families also decide. And then you work with one of our partners to bring Zemplee into your home. So we work with home care agency partners across the country who will set it up and make sure it's working fine. the type of assistance that we give. But there are two ways it can happen. We ship a kit to your home. Either a son or a daughter can install it. It's very simple to install. There are peel and stick sensors that go on the walls or on your furniture. Turn on a switch. There's a hub that collects all the data. So the technical part is very simplified. The minute you turn on the hub, we know you're live and it comes on, the data starts coming into our system. And then from there on, it's on autopilot, right? We program who needs to receive the alerts, et cetera. So it's pretty much a very curated step to onboard you. When you work with our agency partners, they'll work with you. They go through a traditional intake form. They make sure you're the right candidate for it. So that's on. And then we support both private pay models. And then we're also working with different states on a special program that is sponsored under Medicaid HCBS waivers. So if you are a waivered patient, there's a way you can have Medicaid pay for this product.
Wow.
In other situations, an ideal candidate also someone who's in nursing home and wants to go back into the community and live by themselves, they would be another candidate, the typical candidate for us to give them, because it helps them provide the continuity of the nursing home through a remote care model.
Wow. Can you share an example or a success story where Zemplee prevented a crisis or improved the quality of life for a senior that was out, that signed up for your program?
Oh, yeah. There is a video on our website. So we have a bunch of testimonials on our website. So obviously, I think we love the crochet example that I talked to you about.
I love that. Yes.
It's something unique and different. A couple of interesting ways how people have used it is obviously the data collected from Zemplee can be converted into a report, and you can bring that report and show it to your doctor. So in clinical settings, you can take that data and work with your doctor to say. So one example was someone who had just recently moved back from a surgery, from a hospitalization into home. And it was something related to their foot. I can't obviously share a lot of details, but this was a diabetic neuropathy related procedure.
Uh-huh.
And then the doctor had instruction was that they should not put pressure on their feet, so they should not be walking. But there was a complication of the clinical incident there. And so the person actually took a report from our system, and the system showed that he used to be in bed 8 hours a day and only would get up and walk when he had to go to the bathroom. So he was able to show the doctor, hey, I haven't been using my foot. The clinical, whatever is happening right now is not because I have not followed your instructions. So
I love that.
So that sort of helps with the care plan as well. A lot of people really like the independence part. Mostly when we work with women, aging women, they just like the fact that somebody is there, somebody other than themselves is caring for them, right? So it's not a person, but there's a system watching them. So there's definitely, I think, peace of mind for them, and they just feel a security aspect, right? So that's a big part of what they feel. Just the notion that
I understand that, because so many seniors feel alone in their homes. And I can tell you right now, I have many seniors that have fallen and laid for not just hours, but sometimes days because the family didn't check on them. So I really like this approach where you're like overseeing, but you're not intrusive. And I think that's got to be very comforting to a lot of seniors, because there's most seniors are very private. They don't want anybody to tell them what to do, where to go, when to be there. They just want to do what they want to do when they feel like it. And they feel, of course, as a nurse, I'm always told, you're so bossy. Yeah, I am. But this way, I could actually leave somebody for a short period of time and feel confident that if there is an untoward episode, whether it's a fall or whatever, or if they haven't eaten in for a few hours, or they have them into the refrigerator, that I'd be alerted, so I could either call my care team partners and set one of them and say, hey, could you run over to see my dad? He missed a meal today, I think, and I just want to make sure he's okay. Those kinds of things. So I really like that. And I can see how it would give a family caregiver that's even in the home with their parent or even next door, and they're trying to let the parent have independence, really give them a sense of confidence that everything's going to go well. And if it doesn't, they're going to be alerted. So.
Yeah, I think one of the strongest value proposition, each of the stakeholder gets to do what they want to do. The family can do what they want to do. The senior can go about their lives. And there's a system that's managing, not through technology, managing the relationship. That's what we like about it. Can AI get to a point where it can replace a caregiver? My answer, at least as of today, is never. I don't think the emotional quotient of what a human can do, especially for caring for your elderly, is way out there. I don't even see it.
I don't ever see that happening, only from my perspective.
I think as a society, we want to encourage that. We don't want to robotify the care.
No.
So we feel like, so our focus is always how to be sensitive to that, right? I don't want to replace everything that a human can do, but how do I make the combination of that exponentially better and manageable, right? At the end of the day, as a son or a daughter, you do have your own responsibilities. You have to care for your families. You want to go on a date, watch a movie, etc. You want to be able to do that, but not be worried about your elderly parents while you're doing that. And I do have a lot of friends who, even socially in my own life, when we all have friends who have aging parents, and we see this, right? We have to leave at 9:00 because mom is alone in the house.
As a mom that's had two sons, and I've cared for my dad. My mom died when I was young. I have to tell you, I can see doing it in my own home while I'm at my dad's, so I know where my seniors, my teenagers are. I can see that because I had boys and they were challenging. And if they're supposed to be home in bed while I'm overnight at grandpa's, and they're not there, this would be a great, but that's just me looking at the applicable side for people that have, so many are the sandwich generation. Like you had your seniors, your parents, but you also had adult or children that were in high school and stuff. And so I can see that it would be good to have two packets, one for one house and one for the other. That's just my creativity.
Absolutely. Yeah.
So now data privacy is a big concern with technology. How does Zemplee ensure that the senior's personal and health data stay secure?
So first of all, from a policy standpoint, we implement and apply all the HIPAA and high-tech rules for our product. So going into the technology itself, we decided to lean in towards the HIPAA side. So the data that we collect is only used for delivering value to the end user, which is either the caregiver or the elderly themselves. We don't share data with anyone because we don't need to. Yeah. Also, it's very complicated to find other applications for the data. So anything that we do is either going into research, because we do take that data to train our AI models, and everything that we've built is what is called as on-prem. So it's our own technology. We don't use any third-party tools. So we hand-coded and built our entire AI application. So it's private from that standpoint. The data, again, until we know for sure where we want to explore further with some of this new technology that's coming up, like language learning models, etc., we're going to tread carefully, predominantly trying to keep privacy as one of our main vector for that matter. The other way, we also are very transparent about what we do with the data. When we are using it to train our models, if someone wants an explanation or reasoning of how we're doing it, we're more than welcome to share with them how so we make transparency a big part of our value proposition to the customer. And again, in terms of just the security infrastructure, etc., we use the best of the best. We use Amazon for our hosting and use all kinds of data security, data compliancy protocols that are needed to ensure that the senior is safe in their home. And part of the reason why we do that also is, in addition to not just addressing the technology aspect of gathering the data, we also up-level it by a little bit by saying we are custodians of this data, because oftentimes we work with clients who really don't know what decisions they should be making about the data. So, for example, I think one of the culturally in our company, what we say is we always ask the questions, what would you do if this was your mom or dad's information or data? So that culturally, that brings that extra level of scrutiny on everything that we do. And that I think is important, especially if you're working in the senior space, because the laws are changing so frequently in today's world that having this do the right thing and go a step beyond and always question, would you do this if this was your mom or dad? So the answer is obviously no. And so that's how we ensure that whatever we do is 100% safe, reliable, and trustworthy. That's our story on the transparency side. And trust
Looking ahead, how do you see AI shaping the future of caregiving or senior living over the next 5 to 10 years?
So obviously, we see a lot of providers adopt more and more AI. I think to the extent that it is helping them with improving operational efficiency, reducing the burden on an already short caregiver workforce, making it simplifying things for them so they can do more with less. And that's the best use of technology, right? It helps with improving productivity. It helps with improving operations. I think documentation management is a big part where we see a lot of AI come in and help with doing repetitive, redundant tasks. We also integrate with EHR systems. So whatever we collect in our system, if it has clinical relevance, we can push it back into a patient's health record. So a clinical provider who is seeing this data can also get a holistic view of this person. So I see a lot of that, the interoperability between systems evolve.
That's fascinating.
In the next 5 to 10 years. In general, I think the lack of financial support and the lack of human resource support makes this a great candidate for bringing a lot of automation and AI into the mix. And I think it will only change for the better. And we're already starting to see that. And it's only going to get better. That's how we feel.
Zemplee is definitely something that we need in the senior industry, care industry. Family caregivers are pushed beyond limits, and they're expected to do things once done by healthcare professionals. So I don't know if you know this, but 63% of family caregivers become seriously ill or die in the U.S. before the person they're caring for passes. And I love the ability to be able to have people monitor, more than one person monitor a senior's home. I just think that's really important. Aparna, how do they find Zemplee and learn more about it or find you?
So the best way to find us is to reach us on our website, www.zemplee.com. And if you are in the region where we are offering the services, we'll connect you with a local partner to get the conversation started about bringing Zemplee into your home. And if you're a facility, we'll work with you directly or one of our regional representatives who can help you with your scoping out. So the facility installations are a little more involved, but we do have regional representatives who will work with you to bring and onboard the product into your organization. So we're currently available nationwide. So, no matter where you are, our theme has always been being remote, so we can serve you wherever you are.
I love that, especially with assisted living. They are with the memory care units and stuff. They're not staffing to acuity level, and they're leaving patients in bed too long, or they're trying to keep them from falling, and they don't want to use alerts anymore, fall alert alarms. So I love this ability for a facility to say, "Oh, Mr. Smith down the hall just fell," or he's trying to get out of bed even. Let's get to there. Thank you so much for sharing your information. I'm really excited. To my listeners out there, I just want my listeners to know that we'll have a link to the website, and we will also have the video that was referred to earlier in our podcast, because I want people to see the product, because it's amazing what it is accomplishing. To my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please learn to be gentle with yourself. Practice self-care every day, because you are worth it.